Welcome to our Jobskin webinar today on the head and neck. With us today is Rosemary Kendall, our clinical advisor based in WA, as well as Veronica Eichmann, our clinical advisor based in New Zealand. With that, my name is Adam Ho. I'm the Managing Director of Jobskin Australia and New Zealand. And with that, I will let Rosemary kick off the webinar.
Hi, everyone. Thanks for joining us today. We hope this is going to be a beneficial 45 minutes or so for you. And as Adam's mentioned, we're talking specifically about using custom compression in the management of head and neck lymphedema. We'll be running a little chat on the side. So if you've got questions, we're really happy for this to be interactive. So you can either just unmute yourself and speak up if you have a question or comment, or if you would prefer, you can type a question into the chat that can run on the side, and Veronica will be keeping tabs on that, and will kind of alert me if I miss that as we're going through. All right, let's get started. So today what we're going to cover is just obviously specific issues related to compression in the head and neck, a bit of discussion about what level of compression is being applied and why you would choose ready to wear or when you would choose to use custom made, and then some specific considerations for the head and neck. We'll look at specifically how to measure, because I think lots of people find it intimidating, and then look at what are the specific options and modifications you can make to garments for the head and neck, and then very brief sort of cheat sheet almost about if you choosing to order, how do you go about it. All right, so now let's start with talking about what compression is really applied. And some of you may have been at the ALA, and some of you may have been at the workshop that we ran about compression and obesity, where we did have a bit of a broader discussion about compression. And there's just a few things that I think it's helpful for us to be mindful of, because when we hear discussion about compression, there's a lot of talk about graduation for very good reason, and also about the use of the law of Laplace. And what I just need to say straight up is that graduated compression doesn't apply to the head and neck. So you are not going to find a garment that is, if we're talking in terms of distal from the heart, you're not going to find that the compression is greater at the top of the head than it is, say, at the jawline. That's just not a thing. And so the law of Laplace doesn't apply. So the law of Laplace, some of you would be familiar with it. Some of you, it might be a bit of a different concept or unfamiliar concept. It's a law of physics, and it talks about how compression changes in a cylinder when the circumferences vary. Now, we don't use that at all for the head and neck, so not a thing. And I would also say that assigned compressions are unreliable for the head and neck. So if you were to say, I want a garment that's 30 millimeters of mercury compression, we would have to say that whoever the manufacturer is, nobody can give you an absolute assurance that you're going to get 30 millimeters of mercury. But for you as a treating therapist, it kind of sets a ballpark, and you know that you are applying a equivalent level of compression. But if you were to put, say, a pico press underneath and measure it, you could honestly say you're not going to be getting 30 millimeters of mercury everywhere, because we've got eyes, nose, mouth, ears, a ball-shaped part of the body rather than a cylindrical shape. So there's a lot of factors that come into play. So you're not going to change your practice in any way, but it's just important that you're aware of that. So we do use a circumferential compression, obviously, because it's being wrapped around the head, and that applies kind of vertically as well as horizontally. And rather than using the law of Laplace for manufacturing the garments, we use a standard reduction factor. So if a measurement is X amount, the pattern will be designed based on an appropriate level of compression by reducing the size proportionally of the garment. That's simplistically put. All right, now, when would you choose ready to wear and custom made? And, you know, I absolutely want to acknowledge that there are a lot of viable ready to wear garment options on the market, particularly when we consider something like chin straps. You do have a number of options, and oftentimes they will be absolutely sufficient. But, you know, for everyone who works in lymphedema, you will absolutely know that the presentation for a patient who's had head and neck surgery, which has resulted in lymphedema, the presentation is often just, it's not a one size fits all type of option. And so if a patient doesn't fit ready to wear garments, whether it's because of the size or the shape or the proportion, then custom made becomes your preferred option. Or maybe when a suitable style is not available, because as I say, chin straps are a great working option in ready to wear, face masks not so much. Maybe when a patient is an odd shape, so if they've had significant flap on one side of their face or head, as opposed to the other, then applying therapeutic compression is a bit more challenging. Maybe if you need additional compression over some areas, if you need additional compression panels. Oh, somehow I've got a bit carried away and I've duplicated when a suitable style is not available. So I think we can say we've covered that. And then also, which is like additional compression, when you particularly need to modify the garment design, whether it's, you know, whether it's covering an eye or reinforcing around an ear, all of those things, then obviously custom made then is your option. So why would you choose Jobskin for the head and neck? Well, obviously, as we've just described, when ready to wear won't suffice. I think one of the advantages of Jobskin is that it is fully customizable. And, you know, as an example, this is not a head and neck, but I was helping a therapist with somebody just last week, incredibly complex. And we're starting from the ground up and really building a compression garment that we've never done anything like that before, but we know the principles of what we're trying to achieve. So regardless of the complexity, the designers will work with you to create something that is going to be therapeutically suitable. And I think one of the other advantages why you choose Jobskin is that any size can be accommodated. This is less of a thing for head and neck, but certainly for a range of garments, Jobskin manufactures garments for, you know, small children to adults and from the whole spectrum of sizes. Skin integrity and comfort obviously is a bit of a factor for many of our patients with head and neck. I do apologise. We've some of our alignment, I just checked it and I thought it was okay, but for some reason when we've put this PowerPoint into Teams, it's changed the font. That's none of us in the Jobskin team that we just try and do a bit of troubleshooting can work out why, but apologies if a couple of words disappear like doffing does here. But one of the advantages is you can modify the garment in, you know, a number of different ways to make it easier to put on and take off. And for the appearance, for people who are needing to wear garments on their head and neck for therapeutic purposes, they're not easy garments to wear because they are highly visible and often very challenging for people to wear. So if we can at least try and make the garment as suitable as possible from an appearance point of view, it helps with having our patients adhere to the regimes we're recommending. So a couple of considerations for the head and neck, and obviously you're not here for me to teach you about things specific to head and neck lymphedema treatment per se, and there's certainly people with far, far, far greater knowledge than mine, but a couple of things that we do need to take into account when we are considering garments for the head and neck is, one is the drainage of the lymphatic pathways, and you would all be familiar with normal lymphatic drainage, but when people have had surgery and radiation, then they have been, those pathways will have been interrupted or altered. And so you're the, as the treating therapist, you're the one in the driving seat there. But that might be that you need to consider changes to how the garment is structured to facilitate optimal drainage where possible. And then also, actually, I wonder if you could excuse me just a minute. There's quite a bit of noise in the adjacent room. I'm just going to see if I could reduce that a little bit so it's not an interruption. I'll be back in just a sec. I do apologise about that, best laid plans and all that. The other things that we need to consider are the functional impacts of head and neck lymphedema. So altered sensation, and so therefore people's ability to ensure correct fit and or their tolerance to compression, swallowing difficulties and the impact of compression on that, breathing difficulties, because we obviously don't want to compromise or increase patients' levels of anxiety with compression. Some patients, as you'd be aware, may have difficulties laying on their back, and if they're needing to wear compression at night, we would consider that. Trismus, so any altered mouth movements, blurred vision, so that might need to be taken into account in terms of size of eye holes, because if there's already compromised vision, reduced neck range of movement, and obviously negative body image. So all the things that we can kind of keep in the back of our mind when we're actually scripting a garment that we might choose. So now, how do you actually go about measuring the head and neck? You don't need to, you can see that image there that shows the paper tapes that some of you would be very familiar with for the Jobskin measuring system. You don't need any of the paper tapes. We don't have some that relate to the head. The paper tapes relate to limbs only. So you just need a standard Jobskin retractable tape measure. You can either use a ruler or the Jobskin measuring card, the handy card, which is a firm, like a heavyweight card, reasonably inflexible, so that's helpful. And then you need to record your measurements on the head, neck and face mask form. And it is important to have that at the time of measuring, because not all measures are required for all garments based on the garment that you're scripting. So now specifically how to measure the head and the neck. We have a combination of what we term linear measures, and they are straight measures. And they are the ones that I have, the font is in red there. And then the measures that are the black ones, they are contour measures. So a lot of the facial features are actually, the pattern designers need a linear measure, but also they are easier to measure when you're measuring a linear measure. So, for example, the eye width, you're not taking a tape measure, and I don't know, you can probably only see me as a tiny little dot in the corner, but we're not wanting to wrap the tape measure like that to go from the external eye, from eye to eye, but rather we use the card to measure from the lateral aspect of one orbit to the lateral aspect of the other. And it's much easier to control by doing that measuring in that way. So on the form, you will find these images that are in that PowerPoint slide there. They are the exact images that you'll find on the form, and each measurement that is listed there has a corresponding number and depicted measurement on there. So you always have a cheat sheet while you're measuring, which is very reassuring to all of us, I'm sure. And I just want to highlight a little bit on the form, because the top half of the form, and we will have another quick look at the form towards the end, but the top half is really to do with your scripting, what kind of neck alignment you might need, or what color fabric you're using. But the measurements are in the bottom half of the form, and you can see that there are pictures listed across there which relate to the specific garment you're choosing, whether it's a full face mask or a face mask with an open head, or whether it's just a chin strap. And below that, the blue, because this is an interactive form, you can type directly into it. The blue are the measurements that are required. The grayed out ones you don't need for that specific garment. So for example, I'm hoping that you can see my cursor on the slide. Can you? No. Okay.
No.
So the second right image, for example, or actually, let's look at the far right image. You can see that only 2 measurements are required because there's only 2 blue boxes. Whereas you read down the column, say the one on the far left, almost every measurement is required. And so when you are, if you're unsure, take more measurements rather than less. But if you're clear about what specific garment you're going to be ordering, then you can just follow down the column and just record those measurements. Now, we're having a little bit of trouble in Teams with the playing videos. This seems to be a recurrent problem. So what we're going to do is I'm going to stop sharing my screen, and it will be taken over by Adam, who's going to play the video that we were hoping to play embedded in this. He'll play it as a YouTube video. Over to you, Adam.
All garments made for the head and neck are measured with a Jobskin retractable tape measure. You may find using a ruler helpful for some measurements. Not all measurements are required for each type of garment, so it is important to refer to the measurement rubric on the head, neck and face mask form at the time of measuring. If the box in the column below the desired garment is grey, this measurement is not required. Head and neck measurements are taken as follows. Ear length, taken from top to bottom of the ear tissue that anchors to the head, not the total length of the ear. Be aware that a head or face garment is supplied initially without ear holes cut, as the best fit is obtained by marking these at the time of first fit. Eye width. This is a linear measurement between the lateral borders of the left and right orbits. Mouth width. A linear measurement taken between the 2 commissures of the lips. Mouth to chin, from the lower edge of the lower lip to the tip of the chin. You may find it helpful to take this measurement with 1 or 2 rulers. Circumference above eyebrow. This is a circumferential measurement around the head taken at the level of the eyebrows with the tape measure parallel to the floor. Circumference around head at chin angle. Another circumferential measurement taken from the chin angle up, pointing towards the crown of the head. Neck circumference. This is the circumference of the mid-level of the neck. Throat desired length. This is a linear measurement taken from the chin angle to the base of the garment, which is usually at the base of the neck. Chin extension collar width. This is an angled measurement from the chin tip to the sternal notch. Width between eyes. This is a linear measurement taken between the 2 medial corners of the eyes. Tip of chin to chin angle. Linear from the chin tip to the chin angle. It may be helpful to use a ruler, particularly if the chin angle is indistinct. Nose to ear. This is a contour measurement from the crease lateral to the wing of the nose, over the cheek to the antitragus. If the face is very asymmetrical, you may consider measuring both sides, providing an additional measurement. Upper lip to beneath nose. Another linear measurement from the top of the upper lip to the centre of the base of the nose. Width beneath nose. A linear measurement taken between the creases that each sit lateral to the wings of the nose. Eyebrow to desired height. This is a linear measurement only required for open head garments and is taken from the eyebrow to the desired top of the garment. Nose length. A linear measurement taken from the bridge to the tip of the nose. Across nose tip. A contour measurement taken from one lateral crease over the tip of the nose to the other lateral crease. The 3D version of the width beneath the nose. All measurements should be recorded on the form as they are taken, and then the forms completed as explained in the introductory video.
Cool.
Okay, I'm hoping I'm back. Can you hear me all right? Yep. Great. So I'm sorry, that video does rattle through the measurements a bit. The editing is quite harsh. A couple of things I just want to add to that. One is you'll see that the linear measures there were taken with a tape measure, and that's because after we recorded that video, which is about 3 years or so ago now, we then developed this Jobskin measuring card. If you don't have, and it's much easier to use these. So you use them for all the linear measures, as I say, and some of those in that video were taken with a ruler. Not all of them, but some of them were. So if you don't have a handy card, then please just, or actually you could even just type that in the chat now, and we can make note of that, and we can pop one in the post to you. A couple of other things I wanted to mention, and that is that chin angle measurement that comes from right at the top of the neck, basically the angle between the jaw and the neck, goes up to the crown. That the tape measure comes just in front of the ears. So if you're not quite sure what sort of angle to apply, then just track just in front of the ears, and you'll find that you're on track. All right. Now, oh yes, and there was one more thing that I thought as we watched the video together. Asymmetry, obviously, with head and neck lymphedema patients, asymmetry is probably the most common problem. So the more that you can, more information that you can provide to the pattern designers, the better. So I have to say, when I'm measuring for someone with head and neck lymphedema, I almost always, anything that is like a one-sided measure, the most obvious one is from the wing of the nose to the antitragus. Always provide 2 measurements, and you can write them down in the comments section. I sometimes find that the mouth alignment is often distorted or altered, so I will maybe mark the center of the nose and then measure out. So I might take a full mouth width, but then I might say from center out on the right and center out on the left. The other thing, and I know Anne-Marie and the rest of the design team would be most grateful if I would mention this, and that is photos help. Photos help enormously. I actually have a beautiful series of photos that I was hoping I could share with you about how much tape measures, and unfortunately we're not able to include specific case studies today, because if ever there is something that it's hard to get consent for, and because we can't de-identify people and still fulfill the purpose of what we're needing to do, it's head and neck lymphedema, because people's identity is evident, but sometimes it can be marked changes, say at where the shape of the occiput at the back, and so if you want to take additional measures because you think you notice there's a distinct change of proportion, do that and jot it in the comment section. But I would say, if at all possible, if you can have consent, then take photos, and you can upload those photos securely through the portal on the Jobskin website. They do not have to be emailed. So you can log on to the Contact Us and upload them through there quite securely. So now we're going to talk a little bit about options for the head and neck. So what can you actually do? There is a brochure, the garment selections and modifications brochure, that sort of gives an overview of all Jobskin garments, but there is a section that we're going to look at in just a sec on the head and neck. So same again, if you haven't been provided with one of these brochures, they are an A3, so they fold down to A4. For me, I can just clinically, I have to have one in my drawer at all times because it's such a handy, ready reckoner. You can download them from the website, or if it's helpful, which I find it's helpful to have it in the heavyweight card. Again, pop your name down in the chat and we can pop that in the post to you. All right, so specifically, the main sort of, I suppose, the family of head and neck garments includes a chin strap that you see on the left, then a open face option, which can have an open head or open face, so a face mask, entirely closed face mask, then collars and neck straps. Then there's a range of additional options, and rather us try and sort of peer at the PowerPoint on our computer screens, I've actually broken these down on a series of subsequent slides. So specifically, the kind of like the main family of garments, we have a chin strap, which you can see the one on the left is a standard chin strap. You can modify the thickness of the top. There is a garment that's called a modified chin strap, where in fact the side panel is extended so that it goes over the ear and it can have a hole cut for the ears. And you, of course, can modify the height over the chin up to the lip. Open head and open face, that's a combination of two options. The open face mask on the right, you can see it's a full head face mask. And sometimes this is helpful for lymphedema patients where they need a bit more over the back of the head, and with good anchorage over the top of the head. Or it can, if they don't need that anchorage at the top of the head, it can also be an open head, which obviously shows people's hair and is a little bit less masking, I suppose. Then a full face mask. And I think this is often what brings people to Jobskin for head and neck lymphedema, where a chin strap isn't sufficient and you do have to go for a face mask. And we'll talk about some of the options that go with that on subsequent slides. They're also available, less likely for head and neck lymphedema, but you can have a chin extension collar for positioning. And the turtleneck. Now, I do want to talk specifically about the turtleneck, but I will talk about this in subsequent slides. But you can see that the turtleneck is basically a straight neck, whereas if you have a look at the face mask there, can you see that there is a bit more shaping in the actual structure of the neck component of the face mask? So variations of that, you can see on the left, the lip strap, that's effectively an open face mask, but there has been a compression strap added over the lip. This can be a helpful addition for head and neck lymphedema. What I would say though is if you chose to do this, me personally, I would most frequently ask for it to be reinforced, because that is a fairly thin amount of fabric to apply any significant compression. Now, the two on the right, they are variations of a face mask, specifically in relation to the nose. If we look at the one on the right, that is a standard face mask with nose covering, and you can see that there is a single piece of fabric that comes across the cheeks, over to the nose, and sort of comes up to the tip of the nose. The seam is along the tip of the nose. Now, if you're wanting more lateral compression, that's perfectly adequate. What I have found is that quite commonly patients, if patients have lymphedema or edema that is coming round onto the front of over their cheeks, that is insufficient because the fabric will tent a little bit up towards the nose, and you need something that's going to sit a little bit flatter onto the cheeks. So the nose contouring option, which is the one in the center, I hope you've got sufficient detail on the screen, but you can see that actually it's as if the nose has been cut out entirely and then a nose piece inserted into the fabric. Inserted into the face mask, so that there is then a seam that goes all the way around the outline of the nose. What that does is it takes the pressure off the tip of the nose and allows the face mask to sit flatter onto the cheek. So if that's where you need compression across the cheek towards the wings of the nose, then the nose contouring option is better. Then you can have some reinforcement around the eyes. You can have the face mask, the ears enclosed on a face mask, and you might have noticed in the video that it actually specifically stated that a face mask is usually supplied without the ears cut. And the reason for that is the complexity of fitting to accommodate eyes, nose, and mouth. Oftentimes there is a risk that the positioning of the ear holes can be slightly off, which is particularly uncomfortable. So best, I know it's a delay, but it's best fitted, marked, quick alteration, and that will be returned directly to you. I just want to highlight too, can you see on the central photo there, this has got no nose covering at all, but can you see how the triangle is cut around the nose? That essentially is the way that a garment will sit with the nose contouring. So it's as if it's cut exactly as you're looking at there, then it's got a nose piece inserted and stitched into it. One other thing that can be quite helpful is the ear pressure flap, which you can see has got additional pressure right at the front of the ear, because if you've got lateral swelling over the cheek, you can, before it sort of goes to the loss of compression over the ear hole, you've got a little bit of additional compression there. So another thing to consider. Then around the eyes, eyes are a little bit tricky, and those of you who have fitted garments for people with head and neck lymphedema will most likely have experienced this, because when people have got diffuse swelling across the face, when you put a garment on, there is a risk that in fact what you are going to do is you're going to push the swelling into the eyelids, upper and lower eyelids. So sometimes reinforcing the eyes might assist, and you will be making that assessment at the time that you're measuring the patient exactly where that swelling is. And sometimes in fact you might need to enclose an eye, particularly if somebody is using their garment for sleeping rather than using it during the day. They might be better off with enclosed eyes, or sometimes with padding that can be inserted under the enclosed eye part or slipped into an eye hole so that there isn't loss of compression over there and forcing the fluid out to kind of where there is that loss of compression. So really what we're talking about is that the edema has to go somewhere, hopefully into being drained, but do consider specifically eyes, nose and mouth, because they're potentially pressure release valves. Apologies for the typo there, it should be openings for the eyes. Then obviously, as we've mentioned at the start of the webinar, you need to consider lymphatic drainage. So the design team will be really helpful in moving seams wherever possible. So because if you can avoid compromising the lymphatic drainage patterns that are intact, if you can speak with the designers and say, this is, I'm really trying to preserve this area. They will do their level best to accommodate that. We do need to talk about anchorage, and that's at the bottom of the garment, which is the neck, obviously, and the top of the garment, which is the scalp. And at the end of this slide, I'm just going to flick back a couple of slides to highlight a couple of things. You might need to consider patients that have got excess saliva. So you might need to accommodate if they're needing to have any kind of gauze padding or something that's absorbent padding to absorb excess saliva. You might need to measure over that, take that into account. And as I mentioned earlier, you might need to consider additional pressure panels over flaps, edematous flaps. Now, I'm just going to flick back just to talk a bit about the anchorage, because this is probably the best slide here. On the illustration with the ear pressure flap, you can see that the fabric continues. It's actually just got a seam around the occiput sort of towards the jaw to shape the garment, and it continues down, and that's what we would probably term a scoop neck, and it's certainly power net. Now, if it's well measured and well fitted, the anchorage should be stable, but for some complex head shapes, particularly when there's flaps or significant defects, the anchorage is compromised, and so that doesn't quite have enough security in the anchorage. I have to say, personally, I'm a big fan of the turtleneck, which I mentioned we spoke about on an earlier slide, that's got a straight design. And the garment in the middle, I'm just pointing to the slide, not that you can see that, but the garment in the middle has got an attached elastic turtleneck. Now, you can have a turtleneck shape that is power net, which means that it has a central seam around the top of the neck, which is different to the illustration for the ear pressure flap. Or you can have 5 centimetre wide elastic. I am a big fan of the 5 centimetre wide elastic, because as long as it's not measured too tightly, it anchors very securely. And you would think sort of your immediate response is to say elastic around the neck, that would be choky, it would be uncomfortable, it would be difficult to wear. But if it's measured, correctly, so just a body measure, it actually feels, I describe it as huggy. It feels huggy around the neck, and it feels very secure, so that the garment itself stays stable. So that's a choice that you can make, and you can make that on discussion with your patient. And if you might want to try with power net, and if the anchorage is not adequate, then you might want to try the turtleneck. But that's something, it's a tip of the day to bear in mind. And look, one other thing that I did want to mention specifically for head and neck patients is that frequently they have issues with scarring, and where there's been flap reconstructions or repair, if their scarring is likely to become hypertrophic or rigid or intractable, you might want to consider sewing, getting Cylon-Tex stitched into it. Cylon-Tex is a fabric that's only 0.5 millimetre thick, and it is impregnated with silicone. I will be honest, the very first time that I came across Cylon-Tex, I was very skeptical, because I thought, why would you stitch something into a garment with a limited life? Because my experience has been with a lot of other forms of silicone, if it's not going to last the life of the garment. But I have been absolutely proven wrong, and the manufacturers of Cylon-Tex suggest that the longevity for Cylon-Tex is 6 to 8 months, and in my experience I have found that to be so. But because it's sewn into the garment, there is no silicone gel sheets to put in place over scarring. It conforms well in itself, but then it's always in the right place, provided that it's been stitched into. And again, that's another good thing that's very helpful with photos with tapes in place, so the Cylon-Tex can be placed in exactly the right spot. And I have to say, it is a very cost-effective option, because when you're providing patients with silicone, or if they're purchasing silicone themselves, it's a recurrent cost, and it's a costly cost. but Cylon-Tex in the long run proves to be a better option. Okay, we're on the home straight. We're just going to talk about prescription and ordering. When you order a Jobskin garment, you have to have the standard order form, which is on the left, and then the measuring form, which we've already had a bit of a look at. I'm just flicking through because I seem to have lost one of my slides because I had enlarged the options that we have. But essentially, we have covered all the options through the images on the previous slides. And as you will have heard me say, if you've been on previous webinars, we are very much here to help. And the designers are amazing. They're always willing to troubleshoot a tricky problem. And in most webinars, someone will put up a comment saying, I totally agree, they're fantastic. And then Veronica, based in New Zealand, and me in Australia, we're very happy to do Zoom or Teams meetings with you, plus or minus patient, or you can email us queries, or phone us with queries. This is what we're here for. I think probably just to finish, I wonder if anyone's got any particular questions or challenges that they may have had with measuring for head and neck garments. We've got a couple of minutes spare that we could answer some questions if that would be helpful. No? If that's the case.
Oh, hang on.
Oh.
There's someone typing.
Okay, sorry, jumped the gun.
Akane says she always finds it difficult with necks.
Akane, tell me a little bit more about that. What are the things that, especially men's throats? Yeah. I do agree with that. With Jobskin, we generally just require a single measurement of the neck. But if you have a particularly complex neck, I know that sounds like a funny thing to say, I would take a measurement at the base of the neck, the center of the neck, and at the top of the neck. And if that's the case, I would suggest that a power net turtleneck might be a better starting point rather than elastic turtleneck. Because if you go for elastic, you will find that you get, say, particularly over protuberant larynxes, is it? Larynx? Sorry, mental blank. You will get increased pressure over the larynx than with a power neck can be shaped a little bit more. So that would probably be the one comment that I would make. But I have to say I agree with you, Akane. But probably provide more measurements rather than less if you're concerned about neck shape. And as I say, maybe consider power net turtleneck rather than a elastic one. Anything else?
I think there are.
Oh, absolutely. Someone's put up a question yeah, these are great questions. Ponytails to be a bit of an issue. Absolutely. In fact, hair full stop can be a bit of an issue. And Akane's also put a comment about beards. Beards can, itchy beards, itchy with power net. I do find that people are less likely to be bothered by itch if you have the satin lining, not the cotton lining, but the satin lining, because it's a little bit smoother or slipperier, so it doesn't tend to catch on beards and irritate it. But obviously you would have to weigh up whether you are wanting to put a lining in or not, but that may help. And ponytails, you can get a ponytail hole cut in there. And that makes a huge difference. Hair is a problem full stop with head and neck, particularly, I mean, if it was me, it would be no problem at all because my hair is so jolly thin and fine. But for people with luscious, thick hair, which I can only dream about, it is really tricky for maintaining therapeutic compression because there's so much spring in the hair. So a couple of things I would say is if somebody has, say, got short hair but it's thick, I would measure really firmly, because you are wanting to simulate how the hair is going to sit in the garment. So if you don't measure firmly enough, then the hair's going to spring out and your compression is going to be all over the place. The other thing that I would say is if they've got a ponytail or long hair, I would fit the face mask and then, or I would ask them tie their hair up in a ponytail, fit the face mask and mark exactly where they like their ponytail to sit. They don't necessarily have to tie their hair up, but they can pull their hair through the ponytail hole. A couple of things, I don't know if that's helpful, but short of, very short hair and shaving beards, it is a perpetual challenge with head and neck garments. I completely agree. Anything else? I'll just while we're waiting, I'll just put up the just the dates for our upcoming upcoming webinars, looking at compression garments for lipedema is the next one, and then we're going to look more kind of widely for compression for the lower limb in July. What I can't quite see, can you see that question? Someone's just asked a question. Yep. What would you add?
What would you add to the garment if there are folds and crevices in the neck?
Okay, that's a good question. A couple of things. Sometimes I would, if there are folds and crevices in the neck, sometimes they will just sit well in, say, a turtleneck. But if it is something that is a really marked problem, I would consider, I have done in the past, I'm not sure about Veronica, I've actually asked Jobskin to provide some satin lining covered foam that we can use as almost like a filler, because if you've got something that is a real crevice and you're putting compression on, you're kind of like sandwiching the two layers of tissue together and amplifying that fold. And particularly if you've got edema, that's a problem. But also if there's any compromise to skin integrity, that too is a problem. So sometimes you can just use gauze, but I quite like having sort of like a little thin foam roll, which someone can just put in there, and it adds to comfort. Veronica, can you think of anything else that you would consider? No. Okay. We might have to love you and leave you because we've got a second run of this webinar in about 10 minutes, and we're finding with some of our technical little hiccups, we are better off if we log out completely and start again. So if we've missed a question that you would, or if you think of something after the webinar, please don't hesitate to email us. If I flick back, so my email is rosemary.kendall, or Kendall spelt Kendall, @jobskin.com. Veronica, it's got a slightly more complicated spelling, so take a quick screenshot. Veronica Eichmann @jobskin.com, and we'd be only too happy to help. Thank you very much for being here. Adam, over to you.
No worries. Thank you once again for joining us. If you need anything else, there's always our website, www.jobskin.com, as well as our YouTube channel. And, all our videos on how to measure and resources are on there as well. So thank you all once again. No, the same link for the second session will be slightly different, but I can send that through to you, Akane. No worries.
Thanks, everybody. Bye then.
Thank you.